and 10 of the events. Again, just want to give you kind of a perspective of where we were to where we're at right now. I got a feeling if we're looking at other communities in the U.S. Who are battling COVID right now, that could be us, where people are waiting to get into an ICU bed. They're on a wait list, if you would. So the idea here is we're probably going to see increased concerns of COVID in our community in the very near future. It's not too late to get vaccinated. It's not too late to use a mask. It's not too late to do the things that we need to do to make sure that we keep COVID out of our community, but really to not inundate our hospitals. We just got done talking with the schools in Lucas County. We went over our recommendations for mask use. We went over quarantine isolation updates. We went over kind of what they need to be looking at over the next couple of weeks to put a plan in place for their schools when they reopen here real soon. But then also to understanding that I'm sure the recommendations that we gave today most likely will change in the future. So we're going to have to pivot so everybody really understands that. We wanted to make sure that, again, we talked to everybody that we promoted vaccine. That is really our number one tool right now that we have to keep everybody safe, to try to allay and limit the spread of COVID. But again, face coverings are another concern that we wanted to make sure that individuals knew our recommendations, and what we're doing is following the CDC guidelines. Anybody who is in a K through 12 building should be wearing a face covering. But you need to understand that it's up to each individual school system, school district, to make that choice of what they want to do, because these are just recommendations. Right now, there are no mandates coming from state to the schools, unlike last year. So universal masking is important. Reduce transmission risk any way they can. We did that last year, keeping kids as far apart as you can, making sure that, you're washing your hands, barriers, just reducing that transmission risk. So that layered prevention strategy. The idea here too is, when you have parents, visitors, guests come in, that's important to understand that, they're likely to add to your issues inside the community, inside of your schools. So make sure you're handling that appropriately. Screening and testing, we talked about how screening and testing should be done in their schools. The rapid tests, we still have some from state, so we've talked about that too, that we're going to try to get those out to them. And again, the contact tracing, the contact tracing quarantine issues really haven't changed all that much since last year. So that was important to just kind of go back over with some little nuances that we have. The newest development that we wanted to make sure too that the schools understood was that we are now at above 50 per 100,000 COVID cases in Lucas County. So now we've reached that substantial category that the CDC has set up. What does that mean? If you go back to the CDC guidance, again, if you're within inside of an indoor setting and you need to wear a mask, it's crowded, you're not alone in an office. Again, that's the CDC recommendation, and we'll be following that starting next week on Monday with the department, as we discuss that with our staff and leadership. With that in mind, I just want to kind of give you a quick update where we were at, and I'll open up the questions.
Go ahead, Bree. Ask your question.
I didn't know if I could just hop in or if I should raise my hand. Thank you.
Sure.
So with this school recommendation, is it just following what the CDC had put out however long ago, or is there any other changes to that whatsoever?
No, really what we're looking at is the CDC guidance. And again, they are recommendations. So each individual school system will dictate and recommend and I guess implement their strategy for mask use.
And following that quickly, if you don't mind, when it comes to our upgrade to the substantial, how long do we plan to stay in that? I think it's over 2 weeks or is it 2 weeks that it has to be for the 50, I can't talk, 50 per 100,000, or what does that look like now?
Well, we're, I think the number is at 54 per 100,000. As you've seen the increase of cases, I'm not expecting that to slow down. I would think that's going to increase. So again, it would be your guess as good as mine when we might come out of that. I don't think, again, we're going to be seeing cases lessen anytime soon.
Caitlin, go ahead with your question.
Hey, Eric, I'm just wondering what your conversations with the schools today, how those went. Are certain schools talking about implementing mandatory masks, or what's their feeling on this so far, this recommendation?
I think what you're hearing from some of the schools is they wish there was a mandate that so they could actually, I guess be all the same, or at least given that ability to be all the same. Again, these are recommendations. There are some schools that I know already have announced that K through 6, K through 8, those individuals are going to have to be masked, whereas those grades above them are going to be optional. So it is a little bit across the board. It was a good conversation. Again, it's the unknown, I think, that everybody's concerned with. That where are we going to go? What does this really mean? How is this all going to play out over the next couple months? So I think there are some legitimate concerns from our school systems about where we're going.
Mel, go ahead with your question.
Yeah, Eric, I'm sorry. Was just getting online when you were talking about our local COVID picture. So we are seeing some, can you kind of retrace the COVID numbers that we're seeing now?
Sure, Mel. Back July 3rd, we had 3 positive cases that were reported to us on that day. As of today, again, numbers are lagging possibly a little bit, but on 8/3, there were 41 cases reported to us. So we are definitely seeing that increase in the community of positive cases. Again, hospitals back in early July, there were under 10 individuals that reported them to be admitted for positive COVID. ICU bed use was just 1 that was reported and no vent use. But then as of on 8/3, they had 43 individuals that were reported COVID admits in the hospitals. There were 20 ICU beds used for COVID and 10 vents. So we're seeing this increase in in the hospitals being used for their resources. All these COVID, again, we don't have those numbers, but we definitely see that there are continued uses of those resources.
Okay, thank you.
Sure.
Go ahead, Bree.
Thank you. How concerning is that to see, that exponentially rise over a 30-day period?
It's very concerning from the public health perspective, and trying to really keep a community safe and healthy. The idea here is you don't want to have disease in your community, but unfortunately this Delta variant and COVID in general doesn't really care about that. So it definitely is a concern. We're out there every day vaccinating individuals, and we're making sure that, again, we're promoting that vaccination concept to everybody we possibly can. And we are seeing a little bit of rise every day in our numbers. We're at 48.9%, I do believe. I think it was the one I looked at last night, of our population that is vaccinated. So that is good, but again, we need more people vaccinated.
Any other questions?
Carla?
Hi there, can you hear me?
Yes.
All right. Could you just reiterate why it's important for kids in schools to wear masks?
We know that masks do work. The concept here, though, is that we know that this Delta variant is highly infectious, and there's a number of reasons for that. So mask use is important because you have both vaccinated who can come down with COVID, but we know that the vaccine works because then they're not severe symptoms. But then there's the unvaccinated individuals that we know that many of them who do come down with COVID could have severe concerns. So masking is important. It's another layer of protection that, again, we can keep schools open, we can keep sports going, and hopefully not have that transmission in the community.
I'm gonna hop in, sorry. Another question, it's Bree. So we're seeing numbers that, pediatric COVID-19 cases jumped over 80% in just 1 week. With schools heading back in, certain amount of people are only eligible to be vaccinated. What kind of, I guess, danger does that pose or threat does that pose?
Again, we're dealing with the Delta variant, which we're still getting research on. COVID in general, we're still getting research on. We kind of knew that the other variants, maybe the kids weren't having issues with infection or severe concerns. Delta variant could be posing it could be posing a different concern for those pediatric individuals, in the sense that they are able to become ill with COVID. More though so than the other variants. So it's important to keep them protected by everybody around them wearing a mask, like in school. And I think you see some of the schools actually did that, K through 6 or K through 8 said that you have to wear a mask in school. And that will hopefully protect them, or increase the protection definitely of them getting COVID.
Thank you.
Sure. Carla?
Sorry, one last question.
Sure.
Did you receive any update from TPS or any other schools as far as how many, what the vaccination rate is amongst the students?
No, we have not.
Okay, thank you.
Sure.
Okay, I think that's it.
Great. Okay. Again, thank you, everybody. I'm sure we'll have another update here in the near future as our COVID concerns continue to increase, and we'll hopefully get the information out to you as quick as we can. So thank you.
And I will go ahead and shoot you all an email in the next 10 minutes that has the guidance that we gave to the school, so they are able to adapt and implement their own policy surrounding mask use outside of the school transportation mandate. So if you have any questions, please feel free to reach out to me, and thank you.